Aren't you excited to start with the most exciting topic, right? Data? Who loves data? Anyone? Anyone? Bueller? Not everybody loves numbers, and even those that have probably presented to some audience that looks like the people in that right column. Why? Because for many people, their aptitude with math peaked in high school. Guess what? Me too. Just Ferris Bueller's Day Off, that's about when I was good at math. I struggled with graphing X and Y after high school, honestly. Barely made it through my statistics class. But data is really important because it helps us make good decisions about where to invest our time and our resources, and more importantly, it can help us make the case to other people who might partner with us and bring their resources to the table. In particular, I want to talk about colon cancer today. We spend a lot of time encouraging people to get screened because we want more people in that blue bar and fewer people in the red bar. And colon cancer testing can find people in that early blue bar when they have a 90% chance of 5-year survival. Unfortunately, not all of Minnesota is above average. I'm sorry, Garrison Keillor, pants on fire there. On the left is colon cancer incidence. On the right is colon cancer mortality. Some counties have higher incidence and higher mortality of colon cancer. That's true with other cancers as well. On the left, you see that our colon cancer screening rates have been going up consistently for years. On the right, you'll see a persistent 20% gap between people on Medicaid and people with private insurance. Both the red and the blue bar have insurance. Insurance is not the problem. On the left, you'll see the data that's the envy of the nation. We actually know variance by preferred language and variance by race in this country. Updated data coming tomorrow. Keep your eyes out for that from community measurement. We do not, however, have that kind of race and ethnicity data for incidence and mortality. We would love to have that data, some of us. But we can't just go looking for data wherever somebody who likes data will go. We need to make sure we build bridges to someplace, and I would like to see more graphs like that pie chart that show us how much pie is left to be eaten, right? Where we don't have good data, we encourage people to think about secondary data sources, and I really want you to think about the fact that only 10% of health outcomes can be linked directly to clinical care, and 40% can be linked to social and economic determinants. Those social and economic determinants are things we can address with policy, systems, and environmental change, the kinds of strategies that are written into every objective in this cancer plan today. I actually got time, right? Garrison Keillor, wrong again. When you look at social determinants, 87 counties are not the same. A state plan that looks at 87 counties in the same way is going to fall down in some of those counties. And we want you to look at these maps very carefully. Don't worry if you didn't bring your reading glasses. We do have posters, and you can see them, study them at your leisure, especially between today's presentations and the working session, or even over the lunch period. In addition, we also, where are these posters? They're in a couple of places. I marked them out. We actually have a few more than I expected, so the arrows don't do justice to all of them. But we want you to find friends and take them over. Walk this way to the posters, and in the spirit of that song, heavy metal and rap can get together. But we have more than maps. We've got charts, we've got graphs, and we've got tables. So any type of style for visual acuity, we're not expecting you to commit all 18 posters to memory. What we want you to do is to find one or two that you like, either because it's got a good idea or just prompts a question, and bring that into the working session discussions today. So we're not just talking about the data, the primary data we have, but what secondary information might inform our strategy and our business planning. So who's gonna do the data walk now, right? Anyone? Right? Bueller? That's right, and we don't just want you to go there, we want a whole parade down Main Avenue to these data walks on their way to the session. If you're really excited by this presentation, there is a working session this morning on data to look at those strategies, to figure out where we should be building these bridges and where we may not need to look. In addition to that, we're going to have a quiz later today, and we're hoping that everybody will participate in that quiz. It's an Increase Your Cancer IQ, and we're not going to reward everyone just for participating. If you pay attention and you do well on this quiz, there may be prizes. Is anybody ready to win prizes? Right? Why do we do this? Why is data important? Because we need good maps. When we travel into new territories, we want maps that are accurate. Fanciful illustrations are pretty, but they don't help us cover the distance as quickly as possible. And we know that that data is very helpful and very engaging. We know this because in 2013, we got tanning bed data for high school girls. For the first time, we mobilized stakeholders, and in 3 years, we cut high school girls' tanning rates by 75%. My question to you is, where else can we do that? What's next?